Integrated crisis management. So how do we apply it? As previously explained, integrated crisis management, or ICM as it's known, is remarkably simple, as simplicity is the only effective way to respond to a crisis. Introducing further complication to a complex environment of a crisis simply does not work. Think of it like this. Walk into your kitchen tonight and you want to make yourself a pizza. You discover as you walk in, you cannot, for various reasons. Maybe there's no flour, the cooker doesn't work, you haven't got the right ingredients. At that point, you can apply integrated crisis management. It's really simple. What integrated crisis management does is follows a very clear set out methodology called the 8R method. So what are the 8 R's? Well, number 1, redefine. Question the question. Was your aim to make a pizza? Probably your aim was to get some nourishment. And you need to constantly ask yourself this question as you're dealing with a crisis. What is your aim? In healthcare, our aims can be relatively simple in the sense that we want to save as many lives as possible. But we need to keep questioning our aims all the way through a crisis to make sure that we're questioning the question, that it's still relevant. So what's number 2? Reprioritize. Set new goals, new objectives. Having decided your aim, you need to reprioritize your objectives to meet your overall aim. And they must be clear about what your aim is and what these objectives and how they will meet your aim. You must understand which objectives now take priorities. Many times, multiple objectives will have to be pursued at the same time, but you have to reprioritize. So what's number 3? Well, number 3 is really simple as well. It's remove. Stop doing the unnecessary. Now, having decided what objectives you do need to achieve right now, you need to remove those that you don't. Remove, delay, or cease doing anything that is not going to add to your aim and it takes up your resources. You don't have the luxury of doing that in a crisis, and sometimes it can be dangerous. So what is number 4? Repurpose. Bring together what you have, being clear what your aims and objectives are in the now. That means recognizing what is available to you now, not what you might have, not what you would like to have, but what you do have. And they can be resources as in things, or they can be resources as in personnel. But you want to bring them together in one response to undertake all of those objectives to meet that overall aim. So what is number 5? Respond. Act. The crisis will not wait for you. Having recognized the need to repurpose what you have to achieve your new aims and objectives, you now need to act to match the event pace. You have to get in front of the adverse impact being created by the crisis. This is known as the event pace. And in crisis, the event pace will not wait for you. The longer you remain behind the event pace, you will not be in control of the crisis. You will only be reactive, and it's only by getting in front of the event pace that you become proactive, and then you take control of the crisis. So what is number 6? Number 6 is review. Constantly checking. Always review your response. It's vital that you review the decisions and, most importantly, your actions. When you've decided to act, you will not know sometimes whether that action is correct until you review it, until you've actually done it. So you have to review it straight away to determine that it is still correct, is still the right thing to do, and if not, have the strength to change it. Go back and repurpose. Go back and reconsider. What is number 7? Re-energize. Visualize success. Now we know what we've got, what we're trying to achieve, what we've got to achieve that with. We now need to re-energize. Clearly visualize what success looks like for your patients, for you, your family, your team, your organization, your country, and globally. If appropriate, you need to build success to support and achieve your teams. This is by empowering your teams, not allowing any difficult decision in isolation. You support your teams to make those decisions, and this will act by empowerment and support to re-energize your teams and therefore re-energize your response. And number 8, probably the most important when it comes to the 8R method, is to repeat. You go back to the beginning. You repeat the 8R methodology. What is our aim? Is our aim still correct? Are our objectives still correct? Are our resourcing still correct? Are we doing the right things? Can we stop something that we don't need to do? Can we repurpose what we have? Can we re-energize our teams? Can we review in real time when we've acted, when we've responded? You have to follow the 8R methodology from 1 to 8 constantly. And you constantly keep going around that loop, 1 to 8, until you have complete control of the crisis and until you take full control and end the crisis.